A hearty good afternoon to everyone, and welcome to our session on Infertility Unexplained. What next? We are here and we are pleased to have Dr. Dhivyambigai Rajendran among us today to educate us on this topic. She is a consultant for obstetrics and gynecology and hence the best person to guide us on this concept of unexplained infertility. So, Doctor, you have the stage.
Thank you. Good afternoon, all. So today I'll be discussing about unexplained infertility and what next. What are the treatment options for unexplained infertility? So the term itself is like when infertility meaning like the couples who are trying to conceive but they are not able to achieve spontaneous pregnancy on their own. So that is infertility. That is like trying for 1 year they are not able to achieve. That is the stage where these couples are advised to undergo certain test evaluation things to understand why they are not able to conceive. There are various investigations, blood tests, scans for the female, and a semen analysis for the male is done as a basic fertility workup, and then trying to find out the reasons why they were not able to conceive on their own. So, what is this unexplained infertility? Here, in among all these couples who are not able to conceive, and when we are doing all these tests, among them, 15% of couples, after all these results comes, these results are normal. So, in these cases, we are not able to find out the particular reason or the cause for their infertility, and majority of other set of couples where there are some only minor abnormalities in the reports which are not severe enough to cause infertility in them. So these are the conditions where we are not able to find out the reason for their infertility. These cases are referred to as unexplained infertility. So this diagnosis is like a very difficult diagnosis. It's actually a diagnosis of exclusion, meaning after ruling out all causes of infertility, if no reasons have been found, then we call it as unexplained infertility. And these are the couples, they are extremely anxious. So first thing is they are not able to conceive, and after undergoing all the reports and the reports are coming out to be normal, now they don't have answers for why they are not able to conceive. So these cases, these are the couples who need lots of support, counseling, and will be explaining all the treatment options available to them to guide them to get pregnancy faster with a good success rate. So going to the evaluation, I would like to explain in detail about what are the basic tests for fertility workup done in a couple coming for infertility evaluation. So the basic test for women is like directed towards ovulation. So to detect if the ovarian reserve, that is the number of eggs and the quality of eggs in the ovary, is normal or not, and whether the woman is ovulating or not. And the third is like to check for the patency of the fallopian tubes. So fallopian tubes are the structures where the male and female gamete meet each other. The egg and sperm meet, and the fertilization happens in the inside the fallopian tube in the human body. So after this fertilization happens, the fertilized egg travels back into the uterus through the fallopian tube, travels back into the uterus and gets implanted. Implantation is nothing but the sticking of the fertilized egg in the inside of the womb, that is the endometrial cavity, where a successful implantation results in positive pregnancy test. So here in this process, the fallopian tube should be open for us to achieve a successful pregnancy through a natural method or through artificial insemination, which is commonly called as intrauterine insemination, IUI method. So the two methods, natural contact and IUI, the fallopian tubes should be open. So that is why we are checking for the patency of the fallopian tubes through a dye test. And next is the scan, the ultrasound scan, where we assess the womb, that is the uterus, for any abnormalities in it. Like for example, if there are any fibroids are benign lumps, non-cancerous lumps in the uterus. If it is located in the inner aspect of the womb, that is into the endometrial cavity, we call it as a special type called submucous fibroid, where that will interfere with the implantation process and causing the irregularity of the womb. And there are fleshy growths inside the uterus called polyps. So these are the polyps or fleshy growths in the endometrial cavity or the inside of the uterus, in inner aspect of the uterine lining, where it again interferes with implantation. And we have septums. Septums are partitions, the membranous structure within the cavity, causing the distortion of the cavity, resulting in implantation failure, and sometimes it can lead to early miscarriages as well. So these are the structural causes. So when we do a scan, if we come to know any of these abnormalities are there in the uterus, be it a fibroid, polyp, septum, or any such abnormalities are there, then we know the okay, this is the reason which is like contributing for the infertility. And once we treat the cause, the woman will be able to conceive easily. So these are the various tests done in the woman. And this blood test, coming to the hormonal profile, which I was discussing, usually we do it on day 2 of the menstrual cycle. So day 1 is the day where the bleeding starts. The next day, the following day, day 2, in fasting status, blood sample will be taken to assess the hormonal function, that is the follicle stimulating hormone and the luteinizing hormone. And this another important hormonal test is called anti-Mullerian hormone (AMH), which can be done on any day of the cycle, but it gives a very important information about the ovarian reserve. That is the number of eggs and the quality of the eggs in the ovary. This value AMH is like as age advances, as the female's age advances, the AMH, there will be decline in the oocyte, the egg quality and the egg number. So that is why, like as the age advances, we can see there is a drop in trend of it's a declining trend in the AMH values. But there are certain cases where the women at a very younger age we find a very low AMH in them. So a low AMH or a poor ovarian reserve. These are the common terms we use. Like poor ovarian reserve or low AMH is less than 1 AMH. So this is where we can expect suboptimal quality of the eggs. So that is where like these women have find it difficult to get pregnant, and there are chances for higher chances for miscarriages when there is a poor ovarian reserve. So, and apart from these ovarian reserve testing, the other hormonal profile like thyroid function test, serum prolactin levels are also checked to evaluate the fertility. And regarding the tubal patency test, we have methods like histosalpingogram, where a dye is injected inside the uterus and an X-ray is taken after the injection of dye to check if there is spill from whether the dye has passed out through the fallopian tubes on either sides through a X-ray. That is called histosalpingogram. And the second is like saline infusion sonography, where a normal saline is injected into the uterus and the ultrasound scan is done to check for the tubal spill on either side, whether the tubes are open or not. And third is through laparoscopy. Through laparoscopy also we can assess the tubal function, where in which we inject the methylene blue dye from below, and through under direct visualization we check for the spill from the both fallopian tubes through the dye being passed through the fimbrial end and getting spilled into the peritoneal cavity. So these are the various methods of assessing the tubal patency or whether the tubes are open or not. This tubal patency test or dye test, which is commonly referred to as dye test, can be done between after the bleeding stops and before the ovulation. Ideally, we plan it somewhere around day 6 to day 9 of periods. The before the ovulation time, this test has to be done, and the scan can be done after the periods to assess the uterine cavity for any abnormalities in them. So these are the basic tests we do it in the females. And documentation of ovulation. Generally, we have a blood test, serum progesterone, which would be in a regularly menstruating woman. We do it on day 21 of periods. And the other way of assessing ovulation is through a follicular study. Follicular study is nothing but a egg growth scan, which has to be started from day 9 of periods. It will be done alternate days till the ovulation is documented. So in this way, we can see the follicular growth, as well as the ovulation. Ovulation is nothing but the egg release process. So through scan also we can assess if the woman is ovulating or not, and through blood test also, through the serum progesterone blood test in the luteal phase. So these are the various tests done in women to assess her fertility. And for the male, it is semen analysis. So this semen sample ideally has to be given after 3 to 5 days of abstinence. So in the semen analysis, we assess for the sperm concentration, sperm count, motility, as well as the morphology, the appearance of the sperm. So all these parameters are assessed. If suppose any of these parameters, one or more of the parameters are abnormal or borderline, we always ask for a second sample to reconfirm the findings. So this is the basic evaluation for the male and female. Now, like after doing all these tests, if everything is found out to be normal, now that we don't know why they have not conceived. So these are the couple called unexplained infertility. So in these cases, treatment options are like first and foremost is the lifestyle changes. So as we all know, this so going into the reasons for why there is unexplained infertility, or what could be the reason beyond these tests, what could be the reasons for an unexplained infertility? It may be due to the poor quality of the gametes, so poor quality of eggs or the poor quality of sperm, or tubal function could be altered. So through a dye test or the tubal patency test, we are just assessing whether the tubes are open or not. For the tubal function, so actually, as I already mentioned, after fertilization, these actually before even fertilization, the tubes has to pick up the eggs from the ovary when it is getting released. So the fimbrial end should be functional. So it has to be has the capacity to pick up the eggs from the ovaries and move it towards the uterine cavity. And similarly, it has to transport the sperms from the uterine cavity to the eggs. So these fallopian tubes have minute hair-like structures called cilia. So these ciliary movements only helps in the transportation of the egg and sperm. And after fertilization, the fertilized eggs are transported from the fallopian tube, the uterine cavity through the ciliary action. So this is the functional methodology, function of the fallopian tube. So there are no particular tests to assess the functions of the fallopian tube. So these are the things which is like not covered in a fertility evaluation, routine fertility evaluation test. So when there is a problem with the egg quality or sperm quality or tubal function, which are like very difficult to diagnose and treat, so these are would be a potential reasons for their unexplained infertility. So in these cases, what we suggest is first and foremost is the lifestyle changes. Lifestyle changes starts with our body mass index. So everybody should be aware of this body mass index or height to weight ratio. In a for a for a normal couple, like both the husband and wife should be in the normal body mass index. So we have this cutoff. We have BMI calculators. You have to just enter your weight in kg and your height in meter square. So once you enter the values, you'll get your BMI. Anything between 18.9 to 24.9 is normal. If it is more than 25, BMI more than 25 is overweight, and more than 30 is comes to the category of obesity. So it has been found now, due to our recent lifestyle changes and sedentary lifestyle and dietary habits, we see like lots of couple being in the overweight and obese category. So this is like this weight gain, the excessive weight gain could be another contributory factor for infertility. And it has been evidence says that if there is at least 5 to 10% of the body weight, there is an increase in the fertility potential. For example, when most of the women who are obese are having like polycystic ovarian syndrome or PCOD problems, where there is a hormonal imbalance and ovulation issues. So these are the cases, or sometimes they may be having regular periods. Even then, the egg quality may not be good. That could be another reason for them being not able to conceive easily. So whenever I say like the normal BMI is less than 25, it doesn't mean that if you are at BMI 30, you have to be coming down all the way to less than 25 to get pregnant. It's just 5 to 10% of your weight loss is enough to improve your fertility potential. Say, for example, your ideal weight is 60 kg and you are at 80 kgs, you may not come to 60 kg. At least 5 to 10% is 4 to 8 kgs weight loss. Even from 80 kg, if you're going to become 76 to 72 kgs, then that itself is enough. That's what evidence says. So, at least 5 to 10% of weight loss would be helpful to improve the fertility potential. So for this, to achieve an ideal BMI, dietary changes as well as regular physical activities would be beneficial. In dietary changes, actually, what we advise is like to take lots of foods which are rich in antioxidants, minerals, and micronutrients. Generally, they are seen in colored fruits and vegetables. Fruits and vegetables are rich source of antioxidants. So another reason for poor egg quality or poor sperm quality is like this oxidative stress, the free radicals generated in our body due to oxidative stress. So this can be counteracted with diet rich in antioxidants, and we have certain medications which are rich in antioxidants, which we do prescribe for all couples who are having unexplained infertility. So these are the things should be kept in mind. So achieving a appropriate BMI, ideal BMI would be a great step towards achieving a healthy pregnancy. And apart from this being overweight, other personal habits, the lifestyle habits like smoking, alcohol, excessive use of caffeine, all those things also could be a contributory reason. So if any of these habits have been there, like better to consider quitting smoking and alcohol, or at least restrict their use to minimum to improve the fertility potential. So these are the lifestyle changes, and that is apart from the during the time of lifestyle changes, we can try expectant management. Expectant management is like just being aware of the fertile period and being in contact around the fertile period, more frequent contacts during fertile period is called expectant management. Like without any treatment, just following the lifestyle and keep continuing your um, trying to conceive pregnancy. So in this, expectant management is not suitable for all couples, because if there are some underlying any other issues like the age factor, mainly the age factor, as we all know, all women are born with fixed number of eggs. So as age advances, women's age advances, there is definitely a decline in the egg quality as well as the egg numbers. So expectant management would not be suitable, ideal for the women with advanced age. But in younger age group women, trying through this expectant management and lifestyle changes for some a few months is okay. They can try with under the supervision of the doctor. So here in the success rate, what are the success rate for expectant management with lifestyle changes? Like it's like somewhere per month, somewhere it's around like all the success rate. What I'm mentioning here is all towards unexplained infertility. A couple who has been diagnosed with unexplained infertility and they want to try lifestyle changes with expectant management, the chances of the couple getting pregnant per month is like less than 5% only. And if they are going to try this method for a full year, 1 year, it will be like the cumulative pregnancy rate we call. So at the end of 1 year, the chances of the couple being pregnant is 10%. So which is a lesser side only. So that's why I mentioned like it is not suitable for women or couple with like advanced age group. And in younger age group couple, yes, they can try some lifestyle changes and try expectant management if they are not able to conceive, and then they have to come for the next line of treatment. So the next line of treatment is like through medications to stimulate egg growth. So that is called ovulation induction. And ovulation induction can be combined with natural intercourse, around with natural intercourse, or through IUI, intrauterine insemination, or the artificial insemination. So in ovulation induction, we give medication starting from day 2 of periods. The ovulation induction medication, that is the medicines used to promote egg growth, are like we have tablet forms and injectables also. So we'll be using both tablets and injectables to promote egg growth. And always this, once we give these medications to promote egg growth, we will be doing the follicular study in the same cycle to monitor whether the follicle is growing and the egg release is happening or not. So it will be always a monitored cycle. So you'll be given tablets or injections, and then you'll be called for follicular monitoring as well. So as we do the follicular study, we know about the egg growth and the ovulation period, and people the husband parameters, like everything is normal, they can try natural intercourse, or if any suboptimal semen parameters are there, then we can try intrauterine insemination also. So here the success rate per cycle for IUI is somewhere around 18 to 20% per cycle. And if you have been trying for 6 months, the cumulative pregnancy rate after trying for 6 cycles, it is around 50 to 60%. So these are the success rates for ovulation induction with IUI. Now, like what if the couple with unexplained infertility has not conceived even after trying for 6 cycles of monitored cycles, natural contact and IUI? So if even after 6 cycles, if there is no success, then what next? What is the next line of management? So it has been it is recommended that, like, people who have not conceived through these methods, the next step would be IVF bar ICSI, so in vitro fertilization. In that, a special technique called intracytoplasmic sperm injection, which would be the best treatment option with a good success rate. So though it is little expensive, but this gives better success rate for couples with unexplained infertility. In what way we are able to get achieve a better success rate in this IVF treatment is that, because here the fertilization happens outside the human body, and especially in this technique, intracytoplasmic sperm injection ICSI, where the sperm is directly injected into the egg, into the oocyte, egg cytoplasm. So here the fertilization is we can overcome the fertilization problems, the fertilization defects, which could be a reason for a unexplained infertility couple, which could be the reason for their infertility, which we won't be able to assess. When the fertilization happens inside the body, we don't know whether though the woman has ovulated and the contact has been on time, we don't know whether the egg and sperm fertilization happening inside the human body. That we can't document that. But in IVF, we are doing the fertilization outside. So this IVF ICSI procedures, it's really helpful for couple who are having some problems with fertilization, as well as we get additional information here about the oocyte quality. Again, in a natural cycle, we can just, in the monitoring, we are just seeing the only the follicle is developing and the follicle releases egg. But then the quality of oocyte, only if we have the oocyte, we can examine the oocyte under the microscope, which we are doing it during the IVF cycles. So we get additional information about the oocyte quality. So in these cases of unexplained infertility, when they come for the IVF stage, when their other methods have failed, their ovulation induction, natural contact ovulation induction, IUI, everything has failed, and finally they reach up to the state of IVF. When we are doing the IVF for these couple, we may get some answers why they were not able to conceive, in respect to any oocyte quality problems or any fertilization defects. All those things, we'll get some answers. And once this IVF, where we give injections, actually IVF, this way mainly we give only injections, apart from injections for 10 to 12 days. And once the follicle grows to the appropriate size, we subject these women for egg pickup. It's a procedure which will be done under anesthesia through ultrasound guidance, transvaginal ultrasound guidance. The follicular fluid is aspirated and eggs are retrieved. These eggs are examined under microscope, and a IVF or ICSI procedure is performed to fertilize the eggs with the sperms. And these fertilized egg, the zygote is allowed to grow for 3 to 5 days, and then after the embryo is formed, day 3 or day 5, depending on the patient's age and the embryo quality, day 3 or day 5 transfer is decided and the embryo transfer is done. So here we are like bypassing the tubal function. Now, for IVF, the tubal patency, tubal function is not required because the fertilization happens outside the body. And we'll be able to know the quality of the egg, quality of the sperm, and the fertilization thing is taken care. So in this way, IVF gives a better success rate for couple with unexplained infertility. So in IVF, the success rate per cycle is 35, close to 35%. So we can compare and see for an unexplained infertility couple who are trying naturally without any treatment, the chances for them to conceive per cycle is like less than 5%. But when they are doing some treatment like ovulation induction with natural contact or IUI, so in IUI, the success rate per cycle is close to 20%. In IVF, the success rate per cycle is close to 35%. So you can see the trend less than 5, 20%, and 35%. So step by step, if they are not able to get pregnant, they have to move to the next line of treatment. And in this era, like we have all the techniques with us which where we'll be able to help these unexplained infertility couples to conceive successfully. So it is like this all these treatment protocols, everything will be individualized as per the patient's need, their age, and the success rate, as well as cost considerations. So that is how we plan a treatment protocol for couples with unexplained infertility. Thank you all, the patient listening, and if any doubts and any queries, I'll be happy to answer all those. Okay. Okay, so take home messages in patients with unexplained infertility, they'll be like more anxious and more worried and stressful because they're having a problem, but they don't know why there is a problem. They don't know the reason for that problem. So it'll be very stressful for them. But then we have all ways to like the methods of treatments are so advanced that each and every couple can get their baby. So one thing is like they should not lose hope, and they should not be taking breaks, long breaks in between. So whenever they're coming for a treatment, if there is a failure, I understand it will be like very difficult, but then somehow you have to make yourself strong to overcome the failure and move towards the successful pregnancy. Till you get your pregnancy, you should not give up and keep trying through all these methods. Through by meeting a proper fertility specialist, they'll be able to guide you and to get pregnant faster. Thank you all for patience.